Hello, this is Arpan Bhattacharya doing the presentation for Team Privacy and Ethics for INFO648 Healthcare Informatics at Drexel University. Our team is composed of myself, Stanley Joseph, Sarah Neergaard, and Saurabh Sircar. So I'll be going over an introduction, major themes within privacy and ethics, the ethical use of health informatics, some professional and regulatory organizations, some medical journals. I will be giving you an overview of what the HIPAA standards and safeguards are, and we will conclude with some real statistics about HIPAA violations. So, what is privacy and ethics, and how is it related to healthcare, and why is it important? So, privacy and confidentiality of patient information are part of the quality of healthcare itself. You cannot have good healthcare without the proper privacy and ethics standards that the patient expects. Patient has a certain level of trust with their healthcare provider, where that may be the physician, the nurse, any person that is involved with the patient's healthcare. The patient must be able to trust them. Finally, privacy also deals with confidentiality. So privacy is concerned with limiting access to information and only using it when needed and only having the right people access it. Confidentiality is tied to it as well, and it deals with protecting the information and monitoring disclosures and making sure that everything is done within the right standards, the right permissions, and it's following the right laws. So the major themes in healthcare privacy and ethics. So in this diagram, you'll see there are two sides of the coin. There's confidentiality and there's privacy, and ethical reasoning is basically creating some topics of interest right in the middle. So as you can see, privacy deals with consent, trust, and protection of healthcare information. Confidentiality deals with the legality, the safety, and the fidelity or accuracy of that information. So what did those major themes in the middle really mean when it comes to using healthcare information? So this paper by Beauchamp really that he came out with in 2007 basically outlines these major themes. So there's patient autonomy. This means that the patient should be the center of their own healthcare decisions. They have the free will to make the decisions. They need the information to act and make informed decisions about how to pursue the next step in their healthcare. Then there's beneficence, which deals with providing a benefit and protecting patients while balancing these benefits against risks and costs when using healthcare information. There's non-maleficence, which basically says that information should which is a principle of causing no harm and protecting patients and providers from misuse of healthcare information. And finally, there's utilitarianism, which means that all healthcare decisions should produce the most benefit for the most amount of people through the proper allocation of resources. So now let's talk about the ethical use of information in the scope of healthcare informatics. So through the advent of EMRs, which are electronic medical records, and electronic health records, and big data technology, there are many new issues that have arisen from using these technologies within the healthcare domain. Many of these issues are being confronted by healthcare professionals, and there are some case studies that have really brought up some major important issues that should be considered. So an example of such tensions can be seen regarding the corporate ownership of human-generated medical data. So medical data can be collected by machines. Now, what do you do with that data? How can that data be used? Do the human subjects have a right to choose what happens to their data? If that data is being used for some medical technology or procedure, do they have a right to profit from it? So those themes that we covered earlier should govern, how that data is used. Those four themes should always be considered when really analyzing if the use of healthcare informatics is an ethical. So there are many professional and regulatory organizations. Some are government, some are private. The main ones are related to the Federal Department of Health and Human Services. They provide training, information, and they contribute to the establishment of national standards to forward healthcare IT efforts. So you see a bunch of acronyms, and you guys can learn more about these organizations if you go to our wiki. We cover all of them, and we provide a little description of each organization. So along with medical organizations that try and define standards and really look at the new cases of healthcare informatics use, and they try and create standards for privacy and ethics, there are also many medical journals that focus in on this subject. So there's the International Journal of Evidence-Based Healthcare, which discusses ethical decision-making with patient data. There's the Bioethics Journal, Theoretical Medicine, Bioethics, American Journal of Bioethics, International Journal of Reliable and Quality e-Healthcare, International Journal of User-Driven Healthcare, and the International Journal of Privacy and Health Information. All of these journals are available through the Drexel Library resource, and if you go to our wiki, I've provided links for all of these journals. So now let's talk about the HIPAA standard. The HIPAA standard is basically a wide umbrella of rules that govern healthcare practices throughout United States. Specifically, Title II detail the way patient interacts with medical systems, and this Title II can be broken down into three major prongs. So the standards attempt to govern administrative safeguards, physical safeguards, and technical safeguards. So all patient information is governed by HIPAA regulatory standards. The administrative safeguards govern the policies, the security management, information access management, contingency plans. What happens if there's a disaster? How is that data backed up? How is that data stored? How do what happens if there is a breach? What is the contingency plan? There are also physical safeguards that are governed by HIPAA. This is the actual physical storage, the facility access, badge readers, making sure that the right people have access to the information and no one else. This also deals with the computer networks, the user governance, all of that. Finally, there's technical safeguards. There's access control, audit control, personal entity authentication. So this is to make sure that the right people are logged in, that the right accounts are made, they're working under the correct roles. And this also has to do with auditing and making sure that there's a log of every time patient data is being accessed and who it's accessed by. So HIPAA is incredibly important. Everything, all the advancements within healthcare informatics related to electronic health records, electronic medical records, all of these new applications and services are under the guidance of HIPAA. Unfortunately, the more we have technological advances, the more violations there are and the more risk there is. So I found a source of data for all of the HIPAA violations as of July 17th, 2014. And basically, this is every single case where there was private patient data exposed to someone who shouldn't have had it. And what I did was I just graphed in a pie graph what was the cause of that. So you can see from the digital, from the use of digital information, computers, laptops, desktops, and the way healthcare providers have transferred from paper-based technologies to digital technologies, there are way more occurrences. Almost 10 million patients with some kind of laptop or desktop theft, which resulted in HIPAA violation. And then you can also see, there's general theft and just general unauthorized access. The wrong person had it. The wrong person had access to the data. So it is incredibly important to consider healthcare privacy and ethics policies and standards when looking at all of these technological advances. Electronic healthcare, electronic medical records, as we've learned in this course, are great, but they should always be taken under the guidance and always be concerned with the privacy, confidentiality, security, and ethical standards of the use of this information. So personal medical information is very sensitive, and all precautions must be taken so patients can trust their healthcare provider. This is incredibly important as we go towards evidence-based healthcare, because decisions are being made based on information. The integrity of this information is very important, because literally lives are, based on this information. So finally, with all the technological advances, human policies governing human actions and how people use these technologies are very important. HIPAA, as well as all of the other standards and all the governing bodies, should be considered when coming up with these procedures on how people use medical data and how people use these devices to work with patient data. We hope you enjoyed our presentation, and you can check out some more multimedia video presentations on our wiki. Thanks a lot, guys.